MOXIE Media presents Man Overboard, a guide to the rescue and treatment of man overboard victims on offshore oil installations and maritime vessels. The first rule when working in a marine environment is to ensure that you are not the man overboard. No matter what the job or conditions, never place yourself in a position to fall overboard. Utilize fall harnesses or lines whenever possible to minimize the chance of going overboard. Whenever performing a job with an inherent risk of falling into the water, have a boat stand by with rescue equipment manned and readied. All that being said, if you do find yourself on a collision course with the water, attempt to minimize your injuries by blocking off your nose and mouth, protect your head with your arms, and brace for impact. Hold your breath until you surface, and then quickly orient yourself to the hazards around you, such as propellers or waves pushing you against the side of a platform or vessel. If you are in danger, take immediate action to move away. Otherwise, stay put. Don't try to swim after a moving boat. You will never be able to catch it. Swimming in cold water causes faster heat loss and uses up valuable energy that you may need to survive. The second rule of working around the water is to always wear an approved PFD, personal flotation device. If you do fall into the water, your chances of surviving are greatly increased when you have a PFD on, such as a life jacket or work vest. A life jacket can help keep your head out of dangerously frigid waters and provide additional insulation to your body. Your company should have a man overboard policy, and it's likely someone noticed you going over. Stay calm, think, and look for any flotation devices that may be thrown to you. Call for help by yelling, or better yet, blow into a whistle. A whistle requires less energy and can be heard over greater distances. Use any shiny devices on you, such as a belt buckle or even a credit card, to reflect sunlight and attract attention. A strobe light is an excellent device for attracting attention to your location at night. If a ring buoy with no line attached is tossed to you, or if there's anything else thrown or floating in the water, climb up on it to get as much of your body out of the water as possible. Your only hope in cold water is to reduce heat loss, which is lost at a much faster rate in water than in air. If a ring buoy is thrown to you with a line attached, grab the line and maneuver the ring until you can get inside it, with your arms hanging over the side of the ring. You can then be pulled to the vessel for retrieval. Keep your eyes open to all potential rescue craft, which may include an enclosed lifeboat, a personnel basket deployed from the installation's crane, a work, utility, or standby boat, a fast rescue craft, and a Coast Guard helicopter with basket. On an offshore installation or vessel, if you see someone fall overboard or spot a man in the water, you should immediately shout out, "Man overboard! Man overboard!" and throw the nearest life ring buoy as close to the person as possible, even if the man in the water is out of range. The life ring will drift with the victim and give rescuers a more precise target area to search if the person submerges or is quickly pushed away by currents. This quick action is even more important at night when it's very difficult to spot someone in the water. A life ring with a strobe light or a life jacket with a water-activated light would again give rescuers a target to track. If a life ring is not readily available, throw anything that is highly visible, buoyant, and able to be grasped. A hard hat, plastic bucket, trash can, any wooden item, and a life float are all appropriate flotation aids. After throwing a ring buoy or some other type of flotation device, contact the bridge or radio room in order that supervisory personnel, standby vessels, and rescue units can be informed. It is very important to keep the person in sight, assigning a crew member exclusively to this task. However, if no one else is around to assist, first contact authorities by radio and then go back and keep track of the man in the water. If the victim is still within range, you should throw a ring buoy with a line attached. Throw it over the man in the water, being careful not to hit him, and then pull it into the victim. Someone may have to enter the water, especially if the victim is unconscious, to assist in his or her retrieval. Never enter the water unless you have been trained for water rescue. And if you do, wear an immersion suit or Type 1 life jacket. Also, take a life jacket for the victim and maintain contact with the installation or vessel by utilizing a swimmer's line. It is almost impossible to retrieve either a conscious or unconscious victim into a vessel or survival craft without some type of retrieval device. This is due to high freeboards and the increased weight of a water-saturated victim. Fortunately, there are now several devices available for quickly retrieving persons from the water into survival craft or rescue vessels. Let's take a look at a few of these newer devices. This particular system, called the Jason's Cradle, can be quickly deployed on lifeboats and vessels. Once the victim is in place, he or she can be rolled in while maintaining the crucial horizontal position necessary for hypothermic victims. This Jason's Cradle can also be utilized as a standard boarding ladder or as a litter to lift injured personnel. The Crew Saver Rescue Ramp is an inflatable ramp similar to those used on airplanes, which can be quickly attached to lifeboats and rescue vessels to form a sturdy platform from the deck to the water level. It allows rescuers to retrieve unconscious victims without getting into the water themselves, creates a platform to perform immediate first aid, and can act as a staging ramp for helicopter retrieval efforts. The rescue ramp can also be used to transfer personnel from one rescue craft to another. This next man overboard retrieval device, called the Life Sling, consists of a buoyant harness with 150 feet of floating line and is designed to be thrown to a man who has fallen overboard from a moving vessel. In a water skier type maneuver, the vessel circles around the victim to bring him the line and subsequent harness. The man overboard can then place the harness around his body with arms on the outside of the harness and be pulled to the vessel. Once at the vessel, light tackle can lift the victim to the boat deck. Other types of retrieval systems found on some vessels include a davit-based system, which lowers a litter or life float to the water surface in order to rescue someone in the water. This process, however, may require a lengthy preparation period. And let us not forget the traditional boarding ladder, which in most cases proves too difficult for injured or hypothermic victims to climb, rendering it useless for unconscious victims. Even in warm waters, the majority of man overboard victims will have sustained some form of injury. Any person who has been retrieved after falling overboard should receive immediate medical attention. In a man overboard situation, the victim should be returned to the offshore installation or mothership as rapidly as possible for medical treatment and possible evacuation to more sophisticated medical facilities on shore. The lifeboat on many offshore installations may be the quickest and safest means to retrieve a person who has fallen into the water. Often standby boats are engaged elsewhere or not available, and platforms are seldom equipped with fast rescue boats. Quickly launch the lifeboat, keeping in radio contact with the platform. Once the victim in the water has been spotted, a lookout should be posted to prevent losing sight of him. The lifeboat commander, also known as the coxswain, should maneuver down weather until the lifeboat is in position to be able to come around, downwind of the victim, leaving a long enough approach into the wind to allow the coxswain time to steady his course and speed. During the approach, hatches on the side of the lifeboat indicated by the coxswain should be opened while the recovery crew stands by, ready with a boat hook, lifeline, or retrieval system. In the last few feet, steady the boat's direction and speed to lessen the chance of running over the person in the water. Once alongside the victim, throw the engine into reverse to stop the craft. The engine should be put in neutral and the wheel turned toward the side of the rescue, preventing the props from getting too close to the victim if power is needed. Retrieve the man into the craft carefully and give immediate medical attention. Once underway, close and secure all hatches. A man overboard, even in the best circumstances, can expect to be in the water a minimum of 15 minutes, which in frigid waters can be deadly. Even in warm waters, rapid rescue is necessary, as the victim can succumb to exhaustion and drowning in mere minutes. In far too many instances, the man overboard will be without a life jacket or adequate clothing. An FRC, fast rescue craft, due to its speed of up to 40 knots, will close the distance to a man overboard faster than a lifeboat or larger supply or standby vessel. Depending upon the weather and sea conditions and the ability to achieve a quick launching, the chances are good that an FRC will be able to retrieve the victim. With good communication from the parent ship or installation, directions can be given to the crew of the FRC to pinpoint the location of the man in the water. Again, the initial approach to the man in the water should be straight on, coming to a standstill once alongside. When attempting to recover the individual into the fast rescue craft, retrieval should be attempted on the windward or weather side. On the lee side, the victim may be forced against and under the rigid hull, as this lightweight craft makes considerable leeway when stopped. Care should be taken to keep persons in the water clear of the stern of the FRC. Many FRCs now are equipped with jet engines which do not pose the risk of propeller-driven craft. Ready your retrieval equipment and carefully bring the victim on board in a horizontal position if possible. This approach method differs from larger vessels that are less susceptible to movement from wind and waves. They should approach victims on their lee. In northern latitudes, cold water can kill within a few short minutes. It is for this reason that all vessel captains should be familiar with and routinely practice these next 4 approach methods of retrieving a man overboard. They include the Williamson turn, Anderson or one turn, oval or racetrack turn, and Y backing. Each of these methods, as mentioned earlier, should place a larger vessel in a final position beam to the wind slightly to windward of the victim with engines backed off. The vessel will act to block the wind and waves from the man overboard while being pushed toward him to facilitate retrieval and rescue. As with any emergency situation, use common sense. If the victim looks like he's about to go under, get to him any way you can. The first approach method we will look at is the Williamson turn, which should be used at night during times of low visibility or when a person has fallen over but is not in sight. The Williamson approach turns the boat around and directs it back down its reciprocal heading. In all approach methods, when the captain is notified of a man overboard, he should bring the rudder hard over in the same direction as the man. This brings the stern away from the person in the water. For example, if a person falls over on the starboard side, put the rudder over full to starboard and stop the engine. The captain should then sound the man overboard alarm, which is 3 blasts 4 times on the ship's whistle or general alarm. In a Williamson turn, once clear of the man, move ahead with the engine using full rudder. When the heading is 60 degrees beyond the original course, shift the rudder to full over in the opposite direction and then come to the reciprocal of the original course. Once on the correct heading, move forward, using the rudder and engines to place the vessel in a proper recovery position, moving from upwind of the victim until dead in the water, with the man alongside well clear of the propellers. The second approach, known as the Anderson or one turn, is the fastest approach method, but requires the greatest amount of skill in handling the vessel due to the lack of a straight approach to the man overboard. Begin again by bringing the rudder over full to the side of the man overboard and stopping the engines. When clear of the man, go ahead full. Continue using full rudder. When about 2/3 of the way around, begin backing the engines to tighten the turn until the victim is within 15 degrees of the bow. Adjust your course as required to attain the proper final approach. The next approach, called the oval or racetrack turn, is a variation of the one turn. It has the advantage of returning to a man overboard even if lost from sight and provides for a desirable straight final approach. It's the most expeditious method available when proceeding at high speed in clear weather. Again, once clear of the man in the water, continue ahead full using full rudder until you come to the reciprocal of the original heading. For example, if your original course was 60 degrees, return on a heading of 240 degrees after turning. Hold this reciprocal heading long enough so that you can make a straight final approach on your original course. Once in position, turn the rudder hard over to return to the man in the water. On a low-profile type vessel, this next Y-backing approach method may prevent losing sight of the victim by remaining relatively close to his or her position. It's appropriate for vessels with a large turning radius, proceeding at slow speeds with lots of backing power. Y-backing works just like the other methods by first swinging the stern away from the person in the water. Once clear of the victim, however, reverse the engines with full power, using the opposite rudder position. Upon reaching proper alignment, move ahead using the engines and rudder to obtain the final approach. Smaller vessels in good weather should consider the Anderson or racetrack recovery methods, while at night or in low visibility, the Williamson turn, with its ability to return the ship back on its original heading, is desired. If a victim has been in cold water for over 15 minutes, hypothermia will become the main danger in surviving if it has not already taken its toll. Hypothermia, in its later stage, causes unconsciousness, which will result in drowning if a Type 1 self-righting life jacket is not worn. As the vessel approaches the person in the water, the crew should be ready to act quickly, as victims appear to give up and become helpless as rescuers arrive. When rescuing a hypothermic victim, assume that the case is severe. The rescue should be made so as to limit the effort of the victim, as additional exertion will produce further heat loss and worsen the condition. A victim may be more susceptible to a fatal condition if they are removed in a vertical position or allowed to sit or walk after the rescue. When our bodies are immersed in water, water pressure on the legs can aid the heart by exerting pressure on the circulatory system. If rescued in a vertical position, blood may tend to pool in the legs, starving the heart, which can quickly lead to cardiac failure and death. Horizontal rescue positions and techniques should be used if possible, keeping the victim's head in a slightly downward position during recovery. If the victim has no vital signs, even with eyes fixed and dilated, skin cold and bluish, and no visible signs of life, there is still a slight chance of revival if the water is very cold. When a person falls overboard, the sudden contact with cold water, lower than 70 degrees Fahrenheit or 20 degrees Celsius, can sometimes trigger a primitive response called the mammalian diving reflex. The body shuts off circulation to almost everything except the heart, lungs, and brain. Any oxygen that remains in the blood is sent to those organs needing it the most. It is possible, especially in frigid water temperatures, that a person who has been underwater for up to 1 hour may be revived successfully. This same type of physiological response is how whales, dolphins, and seals remain underwater for long periods. Upon recovering a victim, immediately begin mouth-to-mouth rescue breathing and CPR. Don't worry about getting the water out of the victim's lungs, as it will be absorbed by the body. Prevent loss of any additional body heat, but do not attempt any warming procedures. Keep up revival efforts as long as you are able. Medical assistance and evacuation should be called for at once. The Coast Guard and other medical agencies are available to advise you on the care of an individual during a medical emergency. However, it is the captain of the vessel or person in charge of the installation who is ultimately responsible for the safety and health of the crew. A thorough knowledge of first aid and evacuation procedures should be a part of every crew's training. If the victim has a pulse but is unconscious, he may be suffering from severe hypothermia. The definition of hypothermia is a significant decrease in the body's temperature, starting at 95 degrees Fahrenheit or 35 degrees Celsius. It occurs when body heat is lost at a greater rate than that which our bodies can produce. To determine if a victim is hypothermic, the following symptoms should be looked for: skin cold to the touch, a blue look to the extremities, shivering, confusion and disorientation, difficulty with simple arithmetic, abnormal behavior, amnesia, aggression, and slurred speech. A victim's body temperature may continue to drop even when he or she is no longer exposed to the elements. Contact the Coast Guard or other medical experts for advice and possible evacuation. While waiting for medical instructions, monitor vital signs. If the victim is breathing and has a pulse, transfer him gently to a warm place. Always move the victim as carefully as possible, placing the body horizontally with the feet slightly raised, keeping movement to a minimum. Cut off any wet clothes. placing the unconscious or semi-conscious victim in a level, face-up position. If vomiting takes place, turn the head to the side. Do not massage or move the victim's extremities. If the victim is still shivering, you may prevent further heat loss by covering the victim with blankets or dry clothing. This technique is passive in nature and allows the casualty to rewarm himself by his own body heat production. When the person is so hypothermic they are incapable of shivering, it is no use wrapping the casualty in blankets if the body is unable to manufacture its own heat. This merely keeps the body cold. Heat must be transferred to the victim as quickly as possible. Attempt these methods. Use direct body contact, especially to the chest, by removing the rescuer's upper clothing and huddling with the casualty inside blankets or a sleeping bag. Add such items as warm wet towels, hot water bottles, and chemical heat packs to areas of high heat transfer, including the head, neck, chest, and groin, being careful not to cause skin burns. These are slow warming methods which will avoid shocking the system and causing the victim's heart to stop. If available, have the victim breathe warm, moist air or oxygen. Don't give the victim alcohol or coffee. An unconscious or semi-conscious victim should be given nothing to drink. A conscious, clear-headed victim who is not uncontrollably shivering may be given warm fluids. The effects of immersion do not cease once the victim has been removed from the water. Often delayed effects may occur up to 72 hours after immersion, and if not treated, can lead to death. If feasible, transport the casualty as soon as possible to a hospital where more intensive rewarming techniques and monitoring of vital signs can be carried out. Good radio communication is vital during a medical emergency, as you must be able to establish clear communication with the Coast Guard or other vessels. All radios should be equipped with several working channels to contact emergency personnel. If working in foreign waters, it is important to have someone on board who can communicate with local emergency agencies. The Coast Guard or medical professionals will want to know a variety of information on the victim's condition in order that they may instruct you on the best method of handling the emergency and to determine the urgency and need for evacuation. If the patient's condition is determined not to be serious, you may be instructed to head for the closest port or to meet a Coast Guard vessel where the patient can be transported to medical facilities. If, however, the condition of the patient is determined to be life-threatening and weather conditions permit, the Coast Guard may decide a helicopter evacuation is necessary. If your installation is equipped with a heliport landing area, the victim can be loaded directly via a stretcher into the helicopter. However, if you are in a vessel or platform not equipped with a suitable landing area, evacuating personnel is much more complicated, as the victim will have to be placed in a Stokes litter or rescue basket and hoisted via the helicopter's winch line. A helicopter evacuation is a serious operation which is dangerous for the patient as well as the helicopter crew. This is especially true at night and in deteriorating weather and sea conditions. If you're instructed to stand by for an evacuation by helicopter, there are several ways in which you can help. Provide accurate reports on weather conditions, particularly visibility, wind speed and direction, cloud ceiling, and sea state. Begin preparations by making sure all crew members understand the hoist procedure. Clear the hoist area, usually towards the stern of the vessel, of all loose gear, antenna wires, rigging, and booms. Be prepared to change areas if the helicopter pilot picks a different location. During a nighttime hoist operation, the pickup area should be well lit. Shine lights on any obstructions in the vicinity to make the pilot aware of their positions. Be sure never to shine any light up at the helicopter, as this could blind the helicopter crew. If the patient's condition is stable, secure a Type 1 PFD around him and move as close to the hoist area as possible before the helicopter arrives. All pertinent information and documents should be included with the patient, such as a packet that describes any medication given, known allergies, an insurance card, passport, visa, and family names and phone numbers. When radio contact with the helicopter is made, the pilot will most likely ask a vessel captain to adjust his course and speed to reduce motion and to keep the stack gases clear of the hoist area. Once all preparations are made, the helicopter will lower either a basket or Stokes litter. A trail line with a weight attached may be used to guide the basket or litter to the deck of the vessel. Caution must be taken to allow the basket, litter, or tag line to touch the deck before crew members handle them to avoid static shock built up from the helicopter's rotors. Often a trained rescue professional will be lowered with this equipment. Follow his or her instructions to the letter. When a Stokes litter is used, it must be lowered to the deck and the patient secured as quickly as possible, being careful not to aggravate injuries further. If the litter must be taken to the victim for loading, unhook the hoist cable, keeping it free to allow the helicopter to reel it in. The Coast Guard will only hoist a patient in a litter that has been lowered by them for this purpose, so don't waste time strapping a patient into a litter found aboard the vessel. Since time is crucial, ready all materials required for the hoist operation prior to the helicopter's arrival. Upon load-in, position 2 blankets lengthwise in the litter and a third folded in half to support the upper body and head. Quickly load the patient in face up and cover him with a blanket. Secure the web straps over the chest, hips, and knees tightly. Once all is secured, signal the helicopter crew to lower the cable, again allowing it to touch the deck before handling it. Hook up to the litter, and when ready for hoisting, radio the pilot or give a thumbs-up signal, holding onto the trail line to steady the litter from swinging or turning. If a basket is used, place the patient inside with a life jacket on, keeping hands clear of the sides by placing them under the thighs if possible. Again, once ready for hoisting, give a thumbs up, standing clear of the basket as it swings around. If a trail line is attached, steady the basket, being sure the line is clear of your feet. The key to successfully retrieving and evacuating a man overboard victim is to constantly train all crew members, both in the classroom and in actual field locations, in order that they may act quickly during an emergency and be confident and proficient in the use of retrieval equipment. Man overboard drills should be conducted at least once every 2 weeks and be pre-planned, emphasizing key learning points. At least every 3 months, the drill should be held while it is dark, and if applicable, while underway. To be as realistic as possible, a man overboard dummy of the approximate size, shape, and weight of a man should be thrown overboard. Man overboard should be shouted and passed to the crew along with the sounding of alarms. A life ring buoy should be thrown over in the vicinity of the dummy with a strobe light and smoke flares added for realism. The person in charge on an offshore installation or the captain of a vessel will alert the rescue team to muster at a fast rescue boat, lifeboat, or particular retrieval station. Any standby boat should be notified for assistance, and on offshore oil platforms and rigs, the crane operator will ready the crane with the personnel basket and 2 crew members aboard for possible lowering and retrieval. A lookout should be appointed whose sole job is to watch the man overboard and continue to point toward him. Any medically trained persons should be standing by to provide first aid. The installations or vessel's communications equipment should be tested by informing shore bases that a man overboard drill is in progress. Every 3 months, throw some unknown factor in, such as the crane, rescue boat, or retrieval device being out of service. At the end of the drill, log entries should be made indicating the length of time it took to recover the man overboard dummy. And always finish the drill by holding a briefing with the rescue team, discussing how to improve performance in the future. Being prepared is not just a motto for the Boy Scouts, but for anyone living and working in a maritime environment. The training and drills that you and your fellow crew members practice today could very well save your life tomorrow.